How do you get out of bed every day? Do you leap out of bed full of the joys of spring? Or are you slow to move, shuffling, moaning and groaning with all the aches and pains? Or maybe you're somewhere in between where you are a bit stiff, but once you get going, you're okay. Joint stiffness, aches and pains are really common in the peri to post-menopause years. And today I'm going to share some tips to help relieve the pain and get you moving again. Hi, I'm Chelsea Green, holistic hormone specialist, and I help women transition from peri to post-menopause naturally using homeopathy, herbs, nutrition, and lifestyle medicine. I truly believe that women can have a better menopause experience, and if that's the sort of thing that you'd like to know more about, make sure to hit the subscribe button because I'm really passionate about sharing this information with you. So joint pain, stiffness, general aches and pains, these are all really common in the peri to post-menopause years. But so are more seemingly complicated issues like hip pain or gluteal tendinopathy, bursitis, tendinitis, particularly of the shoulder. Frozen shoulder is really common in menopause, as is plantar fasciitis and carpal tunnel syndrome. And in fact, frozen shoulder is so painful. I have experienced it myself, and if I can prevent just one woman from getting frozen shoulder with this video, then I consider my job done. If we look at joint pain, arthritis, stiffness, general aches and pains without the menopause label attached to it, what it is essentially inflammation. Inflammation of the joint can be caused by general wear and tear or injury, by eating the wrong types of foods, smoking, and a lack of exercise. And then in terms of menopause, estrogen is joint, bone, ligament, tendon, and collagen protective. So when we have less of its protective factor, it can bring on or exacerbate existing pain and discomfort. But if we look at this holistically, we can see inflammation as messages from the body. So for example, with the shoulder, where are you carrying too much? What are you shouldering that you need to put down? The lower back is often indicative of a lack of support. We store trauma in the hips, and the knees tend to be about major change in our ability to move through that change. So we can always be looking at what the body is trying to tell us when we take a holistic view. In addition to that, tendons don't like hormonal change. So in puberty, we see lots of sprains and strains. In pregnancy, we see pelvic girdle syndrome, and at menopause, we tend to see the frozen shoulders and plantar fasciitis. Plus, with the shoulder girdle, there's a link between frozen shoulder and blood sugar balance. In menopause, because of those lower levels of estrogen, we become more sensitive to blood sugar imbalances. So we always need to be looking at what's going on beyond just the mechanical. Because at menopause, we need to be prioritizing ourselves, and we need to be allowing the body the space and capacity to go through this transition. And if we're carrying a load from other people, if we're spinning lots of plates, juggling lots of balls, we will not be able to honor the process that we are going through, and the body will let us know through signs and symptoms. And we're taught that these symptoms of menopause are terrible things that we have to get rid of, but when we can view them as messages from the body, we can show ourselves a lot more compassion and sit back and reflect on what do we really need. And in addition to that, of course, we have some practical tools that we can use to help reduce inflammation and pain and discomfort. The first thing we want to do is remove sources of inflammation. Sugar is the big one. Sugar is very, very inflammatory and always aggravates joint pain and stiffness. In addition to that, inflammation could be caused by gluten, by dairy, by soy, by corn. We're all individuals, and we just have to kind of be aware of how we feel, how the body feels after we eat these foods. If we find eating these foods aggravates our symptoms, we can try removing those foods for 4 to 6 weeks to see if that helps improve symptoms. Other inflammatory foods which we just want to remove altogether because they're just absolutely terrible for the body are processed foods, trans fats, hydrogenated oils, and vegetable oils, all of which are highly inflammatory and do a lot of damage to the body. Okay, so we remove the inflammatory foods, but then we can add in anti-inflammatory foods. One of the best sources of anti-inflammatory foods are spices. So spices like garlic, turmeric, and ginger are highly anti-inflammatory and are known to help joint pain. Top tip for you, if you're cooking with turmeric, add in some fat and black pepper. That will make your turmeric more bioavailable, i.e. easier to absorb. So your fat That could be the oil that you're cooking in, and just add some black pepper for seasoning, job done. Polyphenols are also anti-inflammatory, so they include all of your berries, blackberries, blueberries, strawberries, raspberries, leafy greens, flax seeds, and olives, to name but a few. Don't forget about herbs. They're really, really nutrient dense. You get a lot of bang for your buck. 2 herbs that are great for arthritis, joint pain, and stiffness are nettle and devil's claw. And of course, we want to be eating lots of phytoestrogens. So phytoestrogens are those plant-based estrogens that help to balance estrogen levels. So they are your cruciferous vegetables like broccoli, cauliflower, cabbage, kale, but also flax seeds, chickpeas, and maca are all a great source of phytoestrogens. Collagen is also a great food source for joint pain. You might have heard about collagen in relation to hair, skin, and nails in the menopause, but it's also really good for joint pain, joint stiffness, general aches and pains. We can increase collagen levels by using bone broths and also by eating cod and eggs. Also think about how the joints work. For nice smooth movement, we need water, we need fluid, and we need oil. So making sure we're getting lots and lots of water, nicely hydrated, and also lots of healthy fats. So your oily fish, olives, olive oil, avocado, nuts and seeds. 2 homeopathic remedies that you might find useful. Arnica for general aches and pains, especially after overexertion. And Rhus tox is a great arthritic remedy. It's really well indicated when it's a case of better for movement. So worse for being still, better for movement. So when you get out of bed, if you're very stiff and it hurts and you struggle to get going, but once you're sort of on the move, you're okay, that would be a Rhus tox picture. And don't forget about exercise. A lot of women get to this stage and everything hurts and is stiff and they stop exercising. And of course, if you have a serious mechanical issue, you do want to work with an osteo or a physio or a chiropractor and take their advice on this. But the general rule is to keep moving. The best type of exercise for menopause in general, but particularly with joint pain and stiffness, is strength training. Strength training is joint protective and bone protective. With strength training, we can build up the muscle around the joint, so it protects the joint. It creates more stability in the joint. So if you're not strength training, I do recommend that you get started. And then of course, we also want flexibility, and this is where yoga is invaluable. Yoga provides flexibility, of course, but also stability and strength. Plus, it's very, very calming, and it helps to reduce those stress levels and overall inflammation in the body. Let me know in the comments below what one tip you could start implementing today to help relieve joint pain. So I haven't talked about bones at all, and estrogen is bone protective. Osteoporosis is a big issue for menopausal women, particularly postmenopausal and beyond. Protecting the bones builds on what we've talked about here today, but it's a big issue and it deserves a video of its own. So I will be covering this at a later date. Make sure to hit the subscribe button and the bell to get notifications of when my videos are published. And in the meantime, check out my video on how to manage hot flushes naturally.